Good morning, everyone. Okay, so this video is just a continuation of where we ended last time. So we are looking at the lower limb, and I'm just going to continue from there. So the objectives of this video as follows. I'll talk about the ligaments of the hip joint, as well as the acetabulum. I'll talk about the lumbosacral plexus. Okay, just by the name itself, you have the lumbar plexus and you have the sacral plexus. And lastly, I'll talk about the ligaments of the knee joint. So when it comes to the ligaments of the hip joint, basically you have three ligaments which you need to take note of. So the first one is the iliofemoral ligament. The second one is the pubofemoral ligament. And the last one is the ischiofemoral ligament. So when it comes to the iliofemoral ligament, just by the name itself, it is coming from the iliac bone going to the femur. So when you look at the iliac bone, that is the iliac crest, then on the anterior aspect of the iliac crest, you're going to have the anterior superior iliac spine. Then below the anterior superior iliac spine, you have the anterior inferior iliac spine. Okay. So when it comes to the iliofemoral ligament, this ligament originates from the anterior inferior iliac spine, as well as the rim of the acetabulum. Okay, so when it originates from there, this ligament has two fibers. There's that fiber there and that fiber, so it forms a Y shape. Okay, and the other name of this ligament is the Y ligament because of this same shape it's forming. Okay, so this ligament goes to insert on the intertrochanteric line on the anterior aspect of the femur. So this is the greater trochanter, you have the lesser trochanter. In between, on the anterior aspect, you're going to have the intertrochanteric line. Then on the posterior aspect, you're going to have that part there, the intertrochanteric crest. Okay, so that is the iliofemoral ligament. The next ligament is the pubofemoral ligament. That ligament there, just by the name itself, it originates from the pubic bone of the pubis to the femur. To be specific, it also inserts on the intertrochanteric line. So this ligament, the pubofemoral ligament, originates from the obturator crest and the superior ramus of the pubis. Then it goes down to insert on the intertrochanteric line together with the fibers of the iliofemoral ligament. Okay, so the iliofemoral ligament, like I said, there's two types of fibers. You have the vertical fibers and you have the oblique fiber. Okay, so it forms a Y shape. Okay. Then the last ligament is the ischiofemoral ligament. So this ligament is originates from the back of the pelvic region. So this ligament originates from the ischium at the point below and behind the acetabulum and attaches at the intertrochanteric line. So from the posterior aspect, it's going to go to the anterior aspect to insert on the intertrochanteric line. Okay, so these three ligaments basically are going to stabilize the hip joint. Then apart from that, you have other ligaments which you can take note of on the pelvic region. Like for example, you have that ligament there, the sacrotuberous ligament, from the dorsal aspect of the sacrum going to the ischiotuberosity. Then the other one which you need to take note of is that ligament there, also originating from the sacrum to the spine of the ischium. So that ligament is known as the sacrospinous ligament. Okay, so sacrospinous ligament, sacrotuberous ligament, you have the ischiofemoral ligament, you have the pubofemoral ligament, and lastly, you have the iliofemoral ligament. There are other ligaments on the pelvic region. You can read those on your own time, but take note of these ligaments. So let me talk about the acetabulum. So when it comes to the acetabulum, you know, the acetabulum is basically formed by three bones. Okay, you have the ilium, which basically form the upper part. you have the pubic bone forming the anterior aspect, and you have the ischium forming the posterior aspect. So the ilium forms the 2/3 or 2/5 of the acetabulum. The ischium forms the 2/5, the posterior and inferior 2/5 of the acetabulum, and the pubic forms the anterior 1/5 of the acetabulum. Okay, so the acetabulum has parts which you need to know. The first part you need to know is that part which is formed by the articular surface, basically by cartilage. So that part is known as the lunate surface of the acetabulum. As you can see, it has a shape of half moon. So it is known as the lunate surface of the acetabulum. Okay, then after the lunate part of the acetabulum, there's that part there. There's this part here, which is known as the acetabular fossa. Okay. Then after that, you have the acetabular foramen down there. Then lastly, you have that ligament there, which is known as the transverse acetabular ligament from one part of the lunate surface to the other part of the lunate surface there. Okay, so basically know those parts about the acetabulum. So now let me talk about the lumbosacral plexus. So when it comes to the lumbosacral plexus, okay, so the lumbosacral plexus is formed by the anterior rami of the nerves, spinal nerves segments from T12 to S4. Okay, and basically the lumbosacral plexus supplies the lower limb. Okay, so it comes to the lumbosacral plexus just by the name itself. It is divided into two parts. You have the lumbar plexus, which is the upper part, and you're going to have the sacral plexus, which is the lower part. So basically, the lumbar plexus is going to supply the ventral upper half. Okay, then the sacral plexus mainly innervates the dorsal side of the lower limb, basically. Okay. So when it comes to lumbosacral plexus, you have a lot of nerves. Okay. So we'll talk about the iliohypogastric nerve. We'll talk about the ilioinguinal nerve. Okay. We'll talk about the genitofemoral nerve from L1 to L2. We'll talk about the lateral cutaneous femoral nerve, which is from L2 to L3. We'll talk about the femoral nerve from L2 to L4. We'll talk about the obturator nerve from L2 to L4 as well. So these nerves are going to come from the lumbar plexus. Then from the sacral plexus, we'll talk about the superior gluteal nerve, the main nerve supplied to the gluteus medius, gluteus minimus, the tensor fascia lata. So that nerve originates from L4 to S1. Then I'll talk about the inferior gluteal nerve from L5 to S2. So the inferior gluteal nerve is nerve supply to the largest muscle on the posterior aspect of the upper proximal lower limb, the gluteal region. You have the gluteus maximus. Okay, so the gluteus maximus is basically innervated by the inferior gluteal nerve. So it originates from L5 to S2. Okay, then we'll talk about the sciatic nerve, the largest nerve in the human body, the thickest nerve, the longest nerve, basically. Okay, then lastly, I'll talk about the pudendal nerve. Okay, so this nerve is the main nerve supplied to the perineal region. Okay, so basically that is the lumbosacral plexus formed by two parts. You're going to have the lumbar plexus up to the obturator nerve, and you're going to have the sacral plexus from the superior gluteal going down. Okay, so let me begin with the lumbar plexus. So when it comes to the lumbar plexus, so the lumbar plexus is composed of segments from T12 to L4. Okay, and it is located next to the lumbar spine, just behind the psoas major muscle. So the psoas major muscle, we talked about it when we were looking at the anterior thigh. Okay, so in addition to this, like short nerves leading to the hip muscles, the lumbar plexus includes the following nerves. So these are the nerves we'll concentrate much on. The first one is going to be the iliohypogastric nerve. that nerve there, okay, originating from T12 and L1. As you can see, they're both contributing to the iliohypogastric nerve. Now I'll talk about the ilioinguinal nerve as well from T12, L1. And I'll talk about the genitofemoral nerve from L1, and you're going to have L2. So that's the genitofemoral nerve. And I'll talk about the lateral cutaneous nerve of the thigh, which is basically from L2 to L4. As you can see, L2, L3, and L4 contributes to the lateral cutaneous nerve of the thigh. Then I'll talk about the femoral nerve. The femoral nerve is from L2 to L4. So this is the femoral nerve. You're going to have L2, L3, and L4. Then lastly, I'll talk about the obturator nerve from L2 to L4 as well. So that's the obturator nerve, from L2, L3, and L4. Basically, those are the nerves we will talk about on the lumbar plexus. Then we will go to the sacral plexus, where we'll look at the nerves there as well. So the first one is the iliohypogastric nerve. Okay, so when you look at this nerve, it originates from T12 to L1. So on this diagram there, you have that nerve there. That nerve is the iliohypogastric nerve. Okay, it's even labeled there. So that's the iliohypogastric nerve. So when it comes to the iliohypogastric nerve, when it originates from T12 to L1, like it runs obliquely, laterally on the quadratus lumborum muscle. Okay, so that muscle you can see there at the back there, that is the quadratus lumborum muscle. From the iliac crest, it's going up there to the 12 rib and the transverse processes there. So that muscle is the quadratus lumborum muscle. And when you look at this nerve, the iliohypogastric nerve, it runs obliquely on that muscle. Then what will happen is that it will run behind the kidneys. Then near the iliac crest, the iliohypogastric nerve pierces the transversus abdominis muscle. So when it comes to the transversus abdominis muscle, when you look at the abdominal muscles, there are basically three muscles which you need to know on the lateral aspect. You're going to have the transversus abdominis muscle, you have the internal oblique muscle, and lastly, you have the external oblique. On this image, you can see the external oblique, outermost muscle. Then you have the internal oblique muscle there. Then the innermost is the transversus abdominis muscle. And when you look at this nerve, the iliohypogastric nerve, it pierces the transversus abdominis muscle. Then the nerves fibers will be in between the transversus abdominis muscle and the internal oblique. Okay, so in between those two same muscles, the transversus abdominis muscle and the internal oblique muscle, the nerve is going to divide into two nerves, basically. Okay, so the first one is that one, which will be known as the lateral cutaneous nerve, and the other one is going to be this one going on the anterior aspect, and it will be known as the anterior cutaneous nerve. So in between the two muscles, the transversus abdominis and the internal oblique, the iliohypogastric nerve is going to divide into two cutaneous branches. The lateral one being the lateral cutaneous nerve, supply the lateral aspect, and the other one, that is going to go on the anterior aspect, which will be known as the anterior cutaneous nerve. Okay, so basically those two are going to supply sensory innervation to the skin above and to the side of the inguinal ligament. Then this same iliohypogastric nerve also supplies the same muscle, the transversus abdominis, because it's piercing it, and it will also supply the internal oblique muscle. Okay, so that is the iliohypogastric nerve. Know its cause and know the divisions, what muscles it supplies. Okay. The next one is the ilioinguinal nerve. Okay, so that was the iliohypogastric nerve. So the next one is this nerve here, which is the ilioinguinal nerve. So it emerges from the lateral border of the psoas major muscle, just inferior to the iliohypogastric ILIOHYPOGASTRIC nerve. So that muscle there is the psoas major muscle. Then on the lateral border, that's where you're going to notice this nerve, the ilioinguinal nerve. Okay, so this nerve passes obliquely across the quadratus lumborum muscle. You've already seen the quadratus lumborum muscle. It is not being illustrated on this image. Then the ilioinguinal nerve then perforates the transversus abdominis near the anterior part of the iliac crest. Okay, the iliac crest is not being shown here, but just get the theory. Okay, and then this nerve communicates with the iliohypogastric nerve between the transversus abdominis and the internal oblique muscle. So then this nerve then pierces the internal oblique muscle, distributing its filament. Okay, and it then accompanies the spermatic cord in males and the round ligament of the uterus in females through the superficial ring. So after piercing like that, this nerve will go on the anterior aspect where it will accompany the spermatic cord in males and the round ligament of the uterus in females. Okay, so that is the ilioinguinal, just by the name itself, ilio, the iliac bone close to the iliac region. Inguinal, it will accompany the spermatic cord in males, the round ligament of the uterus in females through the inguinal canal. The next nerve I'll talk about is the genitofemoral nerve. Genitofemoral nerve from L1 to L2. So just by the name itself, genitofemoral nerve, it will divide into two terminal branches, the genital part and the femoral part. So this nerve, what it will do is that it pierces the psoas major muscle. So that's the nerve there. That's the psoas major muscle. It will pierce the psoas major muscle. Then what will happen is that when it pierces the psoas major muscle, the genitofemoral nerve is going to divide into the genital branch, which is that one, going like that, and the femoral branch, which is that one there, going to the femoral region. Basically, the femoral branch is going to supply the skin on the medial aspect just below the inguinal ligament. So that's the inguinal ligament near the saphenous opening. So that's the skin there is going to be supplied by the femoral branch. Then when it comes to the genital branch of the genitofemoral nerve, it accompanies the spermatic cord or round ligament of the uterus in females. Then what it will do is that it will move through the inguinal canal towards the scrotum or the labia majora in females. Okay, so what it will do is that it will supply sensory innervation as it does for the region of the medial thigh. So for the medial thigh, that's the femoral branch. Then so the skin of the scrotum, the labia majora, those they are supplied by the genital branch of the genitofemoral nerve. Then the genital branch of the genitofemoral nerve also supplies one muscle, which is the cremaster muscle, the muscle of the scrotum. Okay, so basically that's the genitofemoral nerve. The next nerve I'll talk about is the lateral cutaneous nerve of the thigh from L2 to L4. So just by the name itself, lateral cutaneous nerve. So it's just purely sensory in nature. Okay. So this nerve basically supplies the skin on the lateral aspect of the thigh. So what it will do is that it will pass the psoas major muscle. Then after passing the psoas major muscle, it then passes through the muscular lacuna to finally break through the fascia lata. So that's the nerve there to go like that. Then basically it's going to supply the skin on the lateral aspect of the thigh. The femoral nerve. Okay, so the femoral nerve basically is equivalent to the musculocutaneous nerve for the upper limb. So when it comes to the femoral nerve is the longest nerve of the lumbar plexus. Okay, and it runs between the psoas major muscle and the iliacus muscle, and until it reaches the muscular lacuna. on the lateral side of the femoral artery and the femoral vein. So we looked at the femoral triangle there, said the one that was more medial was the femoral vein. Then you're going to have the femoral artery. Then on the lateral aspect, you're going to have the femoral nerve. So this same femoral nerve is the one we are talking about. So what will happen is that, so it's this nerve there from L2 to L4. So the femoral nerve, just below the inguinal ligament, it divides into the sensory anterior femoral cutaneous nerve to supply the skin of the anterior thigh, and into the motor branches that supplies the following muscles. So basically, the femoral nerve supplies the anterior thigh muscles. So you have the iliopsoas muscle, which is made up of, you have the iliopsoas muscle, which is made up of two parts, the iliacus muscle and the psoas major muscle. You have the pectineus muscle, which is a hybrid muscle. The pectineus muscle is also supplied by the obturator nerve, but it is also supplied by the femoral nerve. You have the sartorius muscle, the longest muscle in the human body. Then you have the quadriceps femoris muscle. This is where you have the rectus femoris, the vastus medialis, vastus intermedius, and the vastus lateralis. So basically, those muscles are supplied by the femoral nerve. Okay. Then from there, the femoral nerve is going to continue as the saphenous nerve. So this saphenous nerve is the sensory terminal branch of the femoral nerve that courses along the femoral artery and vein and moves into the adductor canal. So finally, it follows the great saphenous vein to the medial side of the lower leg. Basically, it's going to supply the medial skin of the lower leg, okay? Between the knee and the foot on the medial side, basically. That's the saphenous nerve, okay? Then the last nerve I'll talk about on the lumbar plexus is the obturator nerve. So when it comes to the obturator nerve is from L2 to L4. So the obturator nerve is that nerve there. That nerve is the obturator nerve, okay? So as you can see from L2, L3, and L4. So that nerve there is the obturator nerve. So the obturator nerve moves behind the psoas major muscle distally and leans against the wall of the pelvis. So together with the obturator artery, it enters through the obturator canal. Okay, so you have the obturator foramen formed basically by two bones, the pubis and the ischium. Okay, you have that foramen, and on that foramen you have the obturator membrane. Then obturator membrane, on the superior aspect of it, there's a space there. That space basically is to transmit the obturator nerve, the obturator artery, the obturator vein. Okay. So what will happen is that when the obturator nerve moves to the medial thigh, it will divide into the anterior and posterior branches, which run distally in front of or behind the adductor brevis muscle. So that muscle there is the adductor brevis muscle. And if you want to identify the adductor brevis muscle, just look at the nerve that will appear on the anterior aspect of it. So that nerve that will appear on the anterior aspect of the adductor brevis will be the anterior division. Then the posterior division, you cannot see it because it's posterior to the adductor brevis. Okay. So what will happen is that this nerve, the obturator nerve, is the main supply to the medial compartment of the thigh. Okay. So it will innervate the adductor longus, it will innervate the adductor brevis, it will innervate the gracilis muscle, it will innervate the pectineus muscle, which is also innervated by the femoral nerve, and it will innervate the adductor magnus. Okay. Then this nerve also innervates this muscle here, the obturator externus muscle, okay, which is also found on the medial compartment of the thigh. Then the anterior branch ends in the sensory cutaneous branch, which innervates the palm-sized area at the distal end of the inner thigh. Okay, so I think there'll be a session where we'll just talk about the cutaneous innervation of the lower limb. So take note of these nerves that are innervating the skin So when we have that session, we'll basically just concentrate on the cutaneous innervation of the lower limb. Basically, that's all for the lumbar plexus of the lumbosacral plexus. So now let me talk about the sacral plexus. So the sacral plexus is composed of segments from L4 to S4, and it sits on the piriformis muscle. So it provides short motor branches to supply the hip muscles and further consists of the following nerves. So the most important are described below. These are the ones which we'll take note of. So we'll look at the superior gluteal nerve, L4 to S1. We'll look at the inferior gluteal nerve, L5 to S2. We will look at the posterior femoral cutaneous nerve, S1 to S3. We will look at the sciatic nerve, L4 to S3. And we will look at the pudendal nerve, okay? Because the sciatic nerve is made up of these two nerves, the common fibular nerve, L4 to S2, and the tibial nerve, which is L4 to S3. So these two, they form one nerve, and that nerve is known as the sciatic nerve. So the superior gluteal nerve. So when it comes to the superior gluteal nerve, so it originates from the sacral plexus, I've already talked about. So it arises from the posterior divisions of L4, L5, and S1. Okay, so the superior gluteal nerve is that nerve there. So this nerve leaves the pelvis through the greater sciatic foramen. I'm sure by now you know this foramen above the piriformis muscle. So this is the piriformis muscle. So the nerve that is going to appear above the piriformis is the superior gluteal nerve. Then the nerve that is going to originate below the piriformis is the inferior gluteal nerve. Okay, so superior gluteal nerve, inferior gluteal nerve. So this nerve is accompanied by the superior gluteal artery and the superior gluteal vein. And basically, this nerve is going to innervate the gluteus medius, which has been cut off. It is going to innervate the gluteus minimus, and it is also going to innervate the tensor fascia lata. Okay. Then the inferior gluteal nerve. So when it comes to the inferior gluteal nerve, it also leaves the pelvis through the greater sciatic foramen and runs underneath the piriformis. So that muscle you can see there is the piriformis, and on superiorly you have that nerve which is the superior gluteal nerve, and inferiorly you have that nerve there which is the inferior gluteal nerve. The main nerve supplied to this thick muscle, the gluteus maximus. Okay. So this nerve divides into muscular branches to supply the gluteus maximus that passes posteriorly into the deep surface of the gluteus maximus. As you can see, you've seen those muscular branches. This muscle is a very powerful muscle of the gluteal region. It is the one that will bring about extension. For you to climb stairs, this muscle is actively working, okay? So this is a very powerful muscle, a very big muscle, and it is supplied by the inferior gluteal nerve. Then I'll talk about this nerve, the posterior cutaneous nerve of the thigh. So when it comes to this nerve, it leaves the pelvis through the greater sciatic foramen. Basically, most of the nerves from the sacral division will leave the pelvis through the greater sciatic foramen below the piriformis muscle. So this nerve is also going to leave below the piriformis together with the inferior gluteal nerve, together with the sciatic nerve. Okay, so it then descends beneath the gluteus maximus muscle with the inferior gluteal artery, and then runs down the back of the thigh beneath the fascia lata. So it runs over the long head of the biceps femoris muscle to the back of the knee. As you can see, this is the back of the knee. So it then pierces the deep fascia and accompanies the small saphenous vein to about the middle of the back of the leg. As you can see, it's going a bit even to the leg. So basically the skin of the knee on the posterior aspect is supplied by this nerve, posterior cutaneous nerve of the thigh. Okay. Then the terminal end of this nerve communicates with the sural nerve. Okay, we'll talk about the sural nerve. So that is the posterior cutaneous nerve of the thigh. Then I'll talk about the pudendal nerve. So the pudendal nerve is that nerve there. Okay, so the pudendal nerve is the main nerve of the perineum. Okay, the region there. So it carries sensation from the external genitalia of both sexes, basically. Okay, and the skin around the anus and the perineum, as well as it supplies motor innervation to the pelvic muscles, including the male and female external urethral sphincters and the external anal sphincter, basically. So the pudendal nerve passes between the piriformis muscle and the coccygeus muscle and leaves the pelvis through the lower part of the greater sciatic foramen. So that foramen there is the greater sciatic foramen. As you can see, the pudendal nerve leaves the greater sciatic foramen on the lower part of it. So it crosses over the lateral part of the sacrospinous ligament, which I talked about. Okay, so this is the sacrospinous ligament. Then from there, it enters the pelvis through the lesser sciatic foramen. So that is the greater sciatic foramen, that is the lesser sciatic foramen. So it's going to leave the pelvis and it's going to come back to the pelvis. Okay, so that is the pudendal nerve. So take note of the things it's supplying. Basically, it's supplying the male and female genitalia. Okay. The sciatic nerve, the largest nerve, the longest nerve, the biggest nerve. Okay, the thickest nerve. So the sciatic nerve basically it originates from L4 to S3. Okay, so the nerve passes beneath the piriformis and through the greater sciatic foramen as well, therefore leaving the pelvic region. Okay, then from here it travels down the posterior thigh to the popliteal fossa. As you can see, it will leave the pelvis and it will appear on the lower part of the piriformis muscle there. So that's the sciatic nerve. Then from there, it is going to go to the posterior thigh. Okay. Then what will happen is that the nerve travels in the posterior compartment of the thigh behind the adductor magnus muscle and is it itself in front of the long head of the biceps femoris muscle. So that is the long head of the biceps femoris, and this nerve is in front of it, but it is behind the adductor magnus muscle. So that's how you can identify the sciatic nerve on a cadaver. Okay, so at the popliteal fossa there, the sciatic nerve divides into two nerves. You have that small nerve there and that larger branch. So that small nerve is known as the common fibular nerve, and that bigger branch is known as the tibial nerve. So the common fibular nerve runs on the neck of the fibula, and it is the most injured nerve in the human body, okay, because it is very superficial. And the tibial nerve goes all the posterior aspect. So when it comes to the tibial nerve, so the tibial nerve is from L4 to S3. So this one goes to the posterior compartment, then into the foot. Then the common peroneal nerve or the common fibular nerve travels down the anterior and lateral compartment of the foot, of the leg, then into the foot. Basically, the common peroneal nerve supplies the lateral compartment of the leg and the anterior compartment of the leg. We'll look at the muscles when we do the leg, while the tibial nerves will supply the posterior compartment as well as the foot. So when you look at the sciatic nerve, it carries accessory innervation to the skin of the foot as well as the entire lower leg, except for the inner side, okay, which is innervated basically by the saphenous nerve. So sensation to the skin to the sole of the foot is provided by the tibial nerve. So the sole of the foot is basically via the tibial nerve, and we'll look at those branches when we do the foot, okay? Basically, while the lower leg and the upper surface of the foot is innervated by the common peroneal nerve, okay? So then when you look at the sciatic nerve, the tibial nerve, like I said, it will innervate the posterior compartment muscles of the leg and the muscles at the sole of the foot, the plantar aspect, or the common peroneal nerve is going to innervate the muscles in the anterior compartment and lateral compartment of the leg. So basically, that's the sciatic nerve. We will look at the muscles when we start doing the leg, which is the next session. Then from there, we'll look at the ankle joint, and lastly, we'll look at the foot. So now let me talk about the ligaments of the knee joint. Okay, so when it comes to the ligaments of the knee joint, we all know the knee joint is primarily formed by two bones. So you have the bone there, which is the distal end of the femur. Then down there, you're going to have the tibia. Okay. Then you're going to have ligaments. So this is so when it comes to it, you're going to have the medial aspect, then you're going to have the lateral aspect. So on the lateral aspect of the knee joint, you have that ligament there, which is known as the fibular collateral ligament or the lateral collateral ligament, or on the medial aspect of that ligament, which is the tibial collateral ligament or the medial collateral ligament. Then you're going to have the cruciate ligaments. So cruciate comes from the word cruciform. So cruciform, Jesus was crucified on the cross. So cruciate simply means cross. So these ligaments, they cross each other. You see, they make a cross. One is going like that, then the other one is going like that. So they form a cross, hence the name cruciate ligament. Okay. So let me begin with the anterior cruciate ligament. Okay. So when you look at this diagram, this is the anterior aspect of the knee joint. You have that ligament there, which you will see. So this ligament is basically this ligament here. So this ligament originates from the medial wall of the lateral conda of the femur. So this is the lateral conda of the femur. That is the medial conda of the femur. So the anterior cruciate ligament is going to originate from the medial wall of the lateral conda of the femur. Then it attaches in front of the intercondylar eminence of the tibia, where it bends with the anterior horn of the medial meniscus. So when you look at the tibia there, there's an eminence at the center of the tibia there, where these ligaments basically attach to. So that eminence is known as the intercondylar eminence of the tibia. It is just an elevation on the proximal tibia there, on that surface of the tibia there. So that eminence is known as the intercondylar eminence of this. So this intercondylar eminence is going to have the anterior aspect and it is going to have the posterior aspect. Okay, so the anterior cruciate ligament is coming from the lateral conda of the femur to the front of the intercondylar eminence of the tibia, where it bends in with the anterior horn of the medial meniscus. So as you can see, this is the medial meniscus and that is the lateral meniscus. So the medial meniscus originates from the intercondylar eminence. So you're going to have the posterior root, which originates from the posterior aspect of the intercondylar eminence of the tibia, to the anterior root. And the anterior root inserts on the front of the intercondylar eminence of the tibia. So the meniscus are basically just like ligaments, articular surface. Okay, and then two, you're going to have the medial meniscus and you have the lateral meniscus. Okay, so the anterior cruciate ligament from the lateral condyle to the intercondylar, to the front of the intercondylar eminence of the tibia. Okay, so that is the anterior cruciate ligament. So basically, this ligament functions to resist the motion of the anterior tibial translation and internal tibial rotation. So it is very important to stabilize the rotational stability of the knee joint, okay? And this ligament is the most tiered ligament of all these ligaments we'll talk about, okay? And there's a test which you need to know, which they do at the hospital, and that's your homework. So you should research on the drawer test. Okay, so for the drawer test, that's a test which you do if you want to know if any of the cruciate ligaments have been damaged. And the draw test, there are two types. So you're going to have the anterior draw test and you're going to have the posterior draw test. So you need to know about this test. So that is your homework. So in case you sit in a test, don't say they didn't teach. So it has been given to you as homework for you to go and research. Okay. So basically that's all about the anterior cruciate ligament. Let me talk about the posterior cruciate ligament. So when it comes to the posterior cruciate ligament, this ligament originates from the lateral edge of the medial condyle of the femur. Okay, so this ligament, so the posterior cruciate ligament, which is that one at the back, is going to originate from the lateral edge of the medial condyle of the femur. Then from there, it is going to go posteriorly, okay, towards the posterior of the tibia, just below the articular surface. So from there, it is going to go to the posterior aspect of the intercondylar eminence of the tibia. So that is the posterior cruciate ligament. Okay, so these two, they will form a cross, hence the name, the cruciate ligament. Okay, so the function of the posterior cruciate ligament is to prevent the femur from sliding off the anterior edge of the tibia and to prevent the tibia from displacing posterior to the femur. Okay, so basically the tibia cannot go posteriorly because of the posterior cruciate ligament. Okay, as you can see, the posterior cruciate ligament is from the posterior aspect to the anterior aspect of the femur. Okay, so this basically the tibia cannot go posteriorly because it will be stopped by the posterior cruciate ligament, and this ligament can also be teared. And you need to know the symptoms, or not basically the symptoms, but the test itself, which is the draw test, which I've already talked about. So the draw test, like I said, you're going to have the anterior draw test to test for the anterior cruciate ligament, and you're going to have the posterior draw test to see if the posterior cruciate ligament has been damaged. Okay, so you need to know about the draw test. So then lastly, I will talk about the collateral ligament, which I've already introduced. So you have two collateral ligaments. Okay, so you have the fibular collateral ligament, which is also known as the lateral collateral ligament, and you have the tibial collateral ligament, also known as the medial collateral ligament. So basically, they also help in stabilizing the knee joint. Okay, even they can be a tear in any of these ligaments, and that will bring about a problem. Mostly, these tears happen a lot in footballers. Okay, so they'll come to the hospital, they're playing football, they come with severe pain of the knee joint, and you have to do the tests to see which ligament has been damaged and to repair the ligament. Okay, so basically that's all for today's session. Okay, so we've talked about the hip joint, ligaments of the hip joint. We've talked about the lumbosacral plexus, and lastly the knee joint, the ligaments of the knee joint. Okay, thank you very much for watching the video. The next session, we will begin with the leg. So we will begin with the bones of the leg, then we'll look at the muscles in the anterior compartment, lateral compartment, and medial compartment of the leg.